Welcome to the Deep Dive. Today, we're plunging into an issue that, well, it touches every single one of us, stress.
hmm
It's pervasive, often unseen, and its impact on our health and the broader healthcare system is absolutely staggering.
Yeah, the costs are huge.
We're talking billions of dollars annually, but it's not just about the money, is it?
Yeah.
It's about the toll it takes on our well-being, our daily lives.
Exactly. In this deep dive, it focuses on a really groundbreaking study that asked a powerful question. What if we could use specific mind-body interventions to, dramatically reduce the amount of healthcare people need?
So this isn't just about feeling better then. It sounds like you're suggesting there's like hard science proving these interventions can have a measurable impact on actual healthcare visits.
That's right.
Our mission today is to unpack a fascinating peer-reviewed research article published in PLOS One alongside a summary piece from the Harvard Gazette, both from October 2015.
Right.
We're going to uncover how a program called the Relaxation-Response-Resiliency Program, or 3RP, demonstrably cut healthcare use and what that truly means for you and the future of healthcare.
Let's maybe start by framing the problem. Poor psychological and physical resilience in response to stress is a major driver of healthcare utilization.
Right.
Stress isn't just a mental state, it's a profound mind-body phenomenon. It directly influences our physiology, the course of illness, even how effective our disease management strategies are.
It's not abstract then.
No, not at all. It's very real in its physical manifestations.
And the financial burden is truly enormous.
hmm
The sources point out that stress-related illnesses, things like depression and anxiety, were costing over $80 billion annually in the U.S. back in 2012.
80 billion. Wow.
To put that in perspective, that made them the third highest cause of healthcare expenditures, right after heart disease and cancer.
Which, ironically,
Yeah, and those conditions often carry their own substantial stress burdens, right?
exactly. And what really stands out here is how much of this plays out in primary care settings.
Mm.
Over 90% of people suffering from stress or stress-related problems seek help through their primary care doctor.
90%.
Yeah. They often become frequent healthcare utilizers, with these stress-driven visits comprising as much as 70% of physicians' caseloads.
70%. I can think for myself how a particularly stressful week can almost guarantee a tension headache.
Oh, yeah.
How many times have you or someone you know experienced those persistent physical symptoms that just won't quit, like the headaches, chronic back pain, or that stubborn insomnia?
Right, or stomach issues.
Exactly. Things like gastroesophageal reflux disease, irritable bowel, chest discomfort. These are among the most frequent reasons people seek medical care, and they're common physical manifestations of stress.
hmm
It really shows you just how deeply stress impacts our physical well-being.
So if stress is such a pervasive problem, what's a potential path to a solution? This is where mind-body medicine comes in. It focuses on the intricate relationships between the mind and body and how physiological and behavioral changes affect health and disease.
And these are safe.
Yeah, what's crucial to understand is that these interventions are widely considered safe. They improve symptom management across a variety of illnesses, and they are relatively low cost.
So if stress is the problem and mind-body medicine is the solution, what's at the absolute core of how this works? Like, what's the fundamental mechanism they identified?
That would be the relaxation response. It was first described over 40 years ago by Harvard Medical School professor Herbert Benson.
Okay.
It's essentially the physiological and psychological opposite of the familiar fight or flight or stress response.
The opposite.
Exactly. It's about consciously activating a state of deep rest and calm in your body.
And what happens in the body when you elicit this relaxation response? Does it truly reverse the effects of stress?
It absolutely does. Eliciting the relaxation response leads to decreased sympathetic nervous system activity. That's your body's on-alert stress response.
Right.
This translates to a decreased heart rate, lower metabolism, and a decreased respiratory rate. It's a genuine, measurable, systemic shift away from stress.
For someone listening who might be thinking, okay, this relaxation response sounds good, but how do I actually do it? Is it complex? What are some of the practical methods mentioned in the sources?
It's surprisingly accessible, actually. The sources list techniques like meditation, yoga, biofeedback, deep breathing, even prayer.
So lots of options.
Yeah, these are all practices that can help induce this beneficial physiological state.
The specific program in this study, the one they put to the test, is the Benson Henry Institute's, or BHI's, Relaxation Response Resiliency Program, known as 3RP. How is it structured? What does it aim to achieve?
Well, it's an integrated program conducted over 8 sessions, either in group or individual setting.
Okay, 8 sessions.
And its core elements include relaxation response eliciting meditation, mindfulness exercises, social support, cognitive skills training, and positive psychology.
Quite a mix.
Yeah, the big goal of 3RP is building resiliency. It's about developing skills to reduce your stress response, elicit the relaxation response, and enhance your resiliency.
Yeah.
That's your ability to adapt well, recover quickly, or even thrive in response to stress, adversity, or trauma.
And this isn't the first time 3RP has shown promise, right? Were there prior indications that it could be effective before this big study?
Yes, quite a bit of prior evidence, actually. It previously demonstrated effectiveness in areas like reducing chronic pain therapy needs, improving cardiovascular health, reducing anxiety and chronic stress, easing menopausal symptoms, and promoting positive health behaviors.
Okay.
This new study aimed to quantify its impact on a broader, more tangible metric, healthcare utilization.
Got it. So with all that background, let's dive into the study itself and its methodology. What was the exact objective, and how did they set about trying to prove this connection?
The primary objective was indeed to estimate the effect of the 3RP program on healthcare utilization. It was a retrospective controlled cohort observational study.
Meaning they looked back at data.
Exactly. They looked back at existing patient data rather than conducting a real-time experiment.
And where did they get all this data from? Was it a massive data set?
It was a substantial data set, yeah, drawn from a major U.S. academic health network, Partners Healthcare, which is centered on Mass General and Brigham and Women's Hospital.
Okay, big names.
Right. All the data was pulled from their centralized clinical data registry, the Research Patient Data Registry, or RPDR, with all patient records anonymized and de-identified, of course.
So how large was this group of patients they looked at, and how did they actually measure utilization? What does that mean here?
The sample size was quite substantial. 4,452 patients who received 3RP were compared to a large control group of 13,149 patients.
Wow, that's a lot of people.
Yeah. Both groups were followed for a median of 4.2 years, and utilization was rigorously measured by billable encounters per year, or billable encounters, which basically encompassed any face-to-face contact with a health professional, as well as services like lab tests, imaging procedures.
Pretty much anything that generates a bill.
Exactly. Anytime you interacted with the healthcare system in that way.
And they needed to make sure they were comparing apples to apples, right? How did they control for all the potential differences between people who seek out a program like 3RP and those who don't?
That's a critical point in this kind of study, yeah. They compared patient healthcare utilization for 1 year before and 1 year after the 3RP intervention.
Okay.
For the control group, they used a comparable midpoint to ensure a fair comparison. And to really minimize bias, they used a sophisticated technique called propensity score matching.
Propensity score matching.
Think of it like using a very precise filter to make sure that two groups of patients were as similar as humanly possible, almost identical in terms of age, ethnicity, gender, even pre-existing conditions before comparing their healthcare use.
Okay, so it makes the comparison much fairer.
Much fairer.
That makes sense. And I imagine patients who opt into a program like this might already be heavy users of the healthcare system. How did they account for the possibility that maybe those patients would have naturally reduced their visits anyway, just by virtue of starting at such a high point? You know, the whole regression to the mean thing.
That's a very insightful question, and it's precisely what they addressed. This is important because, as you said, patients who seek an intervention like 3RP might naturally be high utilizers.
Right.
And their utilization might naturally decrease over time, regardless of the intervention. Like someone who is extremely sick, naturally getting a bit better over time, even without a specific new treatment, just because they started at an extreme point.
So how did they separate that out?
To ensure the observed reductions were truly due to the 3RP program, not just this natural leveling off, they conducted a crucial subgroup analysis. They specifically matched high utilizers in the control group with a subset of high-utilizing intervention patients.
Okay. Comparing high users to high users.
Exactly. This allowed them to isolate the true impact of the program.
So after all that rigorous methodology and careful control for bias, what was the bottom line? What did the numbers truly reveal about 3RP's impact?
The main finding, at 1 year, was truly astonishing. The intervention group saw an average, get this, 43% reduction in total billable encounters.
Wow. 43%.
43%. That's a drop from 53.5 to 30.5 encounters per year, on average.
43%. Think about that for a moment. Imagine what a nearly 50% cut in your own annual doctor visits, lab tests, or ER trips could mean for your time, your peace of mind, and your wallet.
Hmm.
That's a massive decrease in actual healthcare use. Was this reduction seen across all types of healthcare encounters or just, say, doctor visits?
No, it was an incredible breadth of impact. The reduction wasn't just in overall encounters, it was across the board.
Yeah.
Clinical encounters decreased by 41.9%,
Okay.
imaging by 50.3%.
Over half for imaging.
Yeah, laboratory encounters by 43.5% and procedures by 21.4%. These were all statistically significant decreases, indicating a wide-ranging effect.
And what about emergency situations? Those are often the most costly and, frankly, the most stressful visits.
Right. The decrease in emergency department visits for the intervention group was striking from 3.6 down to 1.7 per year on average.
Wow, cut in half.
Pretty much. Hospital and urgent care visits also converged with the controls. This is particularly significant given the high cost of emergency care.
And that rigorous subgroup analysis you mentioned earlier, the one that accounted for regression to the mean, did the results still hold up there when comparing those high utilizers?
Yes, powerfully so. Even in that high utilization matched subgroup, the intervention group still showed statistically significant reductions compared to the control group.
Yeah.
An 18.3% reduction across all functional categories, 24.7% across all site categories, and 25.3% across all clinical categories.
So, still very significant drops.
Absolutely. This truly validates the intervention's effectiveness beyond just natural fluctuations in high utilizers.
It's fascinating to see where these impacts were most felt. Which clinical areas saw the most significant changes for the intervention group? Where did this program make the biggest difference?
The top 5 presenting areas for the intervention group were utilization saw significant reductions. We're talking averaging greater than 65% absolute reduction within the group, and over 70% relative to controls were neurologic conditions,
Neurologic.
making up 28% of total encounters, general symptoms at 20%, cardiovascular at 11%, gastrointestinal at 11%, and psychiatric conditions at 9%.
Those sound like areas where stress often plays a big role.
Precisely. The study also noted that intervention patients were statistically more likely to carry primary diagnoses in psychiatric, neurologic, rheumatologic, and gastrointestinal conditions. So it really seems to target common conditions where stress is a major factor.
So what does this all mean for healthcare, for all of us? I mean, the implications here seem pretty enormous.
They really are. First, consider the financial savings. Mind-body interventions are inexpensive relative to the cost of, say, an emergency room visit or a hospitalization.
Right, the program itself isn't that costly compared to.
Exactly. The estimated savings from reduced emergency room visits alone are approximately $2,360 per patient per year.
$2,000 per patient just from fewer ER visits.
Yep. And this translates to an incredible return on investment, or ROI, of just 4 to 6 months based on typical program fees.
A 4 to 6 month ROI is remarkably fast for any healthcare intervention. Were there any caveats mentioned about achieving that, or is it truly that straightforward based on these numbers?
The study authors frame it as a clear opportunity for rapid return. I mean, the numbers speak for themselves there.
Yeah.
And it gets even bigger when you look at broader cost savings, including outpatient, urgent care, and hospitalizations.
Okay.
Those are estimated to range from $640 to $25,500 per patient per year using median costs.
Wow, quite a range.
Yeah, or an even more dramatic $1,560 to $200 per patient per year using average costs. These are large-scale estimates, of course, but they certainly point to an enormous financial opportunity for the healthcare system.
And it seems like these results align with a broader, more progressive shift we're seeing in healthcare, moving away from treating disease to focusing more on patient wellness, right?
Precisely. What's striking here is how these results align with that broader shift. Moving away from high utilization of specialized care for late-stage disease towards an emphasis on patient-centered approaches.
Things that promote wellness.
Yeah, wellness, self-care, preventive care. This isn't just about cutting costs. It's about fundamentally changing how we approach health and our role in it.
It also appears the public may already be ahead of medical and insurance organizations in adopting these patient-centered approaches. The sources mentioned that over 10% of adults in the U.S. reported using mind-body medicine tools back in 2012, with 8% using meditation, 11% deep breathing, and 10% using yoga, tai chi, or qigong. People are clearly interested in these methods.
And probably even more so now, a decade later.
I'd imagine so. This raises an important question. Based on the study, who benefits most? Who should be looking into something like this?
The analysis suggests that patients with mental health, neurologic, Musculoskeletal and gastroenterological concerns, particularly those with high levels of stress, are most likely to benefit.
Okay.
Also, other high-utilizing patients identifiable via electronic medical records are prime candidates for these interventions. So if you find yourself frequently at the doctor for these kinds of issues, this study suggests you might be a strong candidate.
Of course, like any good study, this one has limitations. It was a retrospective study, meaning they looked back at existing data, which can introduce potential selection bias. Why is that important for us to keep in mind?
It's important because it means researchers didn't randomly assign people to groups. People chose to enroll in 3RP.
Right, so they might be different somehow.
Exactly. They might have had specific motivations or characteristics that weren't fully captured. Also, they relied on administrative data, not specifically designed for clinical studies.
But they did try to control for that.
Yes, as we discussed, the researchers used rigorous matching methods, like propensity score matching, to minimize these biases as much as possible.
And while the study showed dramatically reduced encounters, it didn't perform a full, detailed cost-effectiveness analysis or examine long-term outcomes like mortality or morbidity. So there's still more to learn, right?
Exactly. The researchers themselves call for future prospective studies, meaning studies designed from the start to follow people forward, to delve deeper into these areas and follow patients for longer.
Because this was just 1 year post-intervention.
Right. The study only followed patients for 1 year post-intervention, so the full long-term effects on healthcare utilization are yet to be explored.
But despite those limitations, the study's policy recommendation is clear and powerful. Mind-body interventions like 3RP should perhaps be instituted as a form of preventative care.
Yeah, that's a strong suggestion.
They suggest it could be similar to vaccinations or driver education, applied to all at-risk populations due to their minimal risk, minimal cost, and, well, potentially substantial benefits.
If we connect this to the bigger picture, it suggests a profound reevaluation of how we approach health and illness, moving away from simply reacting to symptoms.
And that leads us to our final thought for you to ponder. If simple, low-cost mind-body practices can so profoundly reduce our need for medical services, how might fully integrating them into our healthcare system and our daily lives redefine what it means to be truly well, moving us from reactive treatment to proactive holistic health?